Neurofibromatosis is a genetic disorder in which tumors form in tissues of the nervous system. Today, we will be focusing specifically on type 1 neurofibromatosis as it is the most common. The onset is either childhood or the first years of adulthood. The prognosis is a normal life expectancy except for the 10% who may develop life-threatening complications such as cancer. The treatment includes surgery for the tumors and drugs to manage the symptoms. The cause of neurofibromatosis is a genetic mutation on chromosome 17 passed from parent to child. This is Marvin. Marvin is a kid diagnosed with neurofibromatosis. His symptoms will start with flat, light brown spots on the skin. He will then get freckling in the armpits or groin area. Next, he will get tiny bumps on the iris of the eye and small, soft bumps under the skin. He will then develop bone deformities, learning disabilities, a larger than average sized head, and will have a shorter stature than the average kid of his age.
In a normal cell signaling pathway, two ligands bind to monomers to create a dimer, specifically a tyrosine kinase receptor. The receptor then produces RAS, which produces proteins that increase cell growth. The RTK also produces myelin, which produces proteins to limit the cell growth caused by RAS. Myelin by itself is not enough to regulate cell growth. In a normal cell signaling pathway, neurofibromin is found in the cell and inactivates RAS, as well as producing proteins to regulate cell growth created by active RAS. The neurofibromin and myelin together act as an effective cell growth regulation system. In a disease cell signaling pathway, the neurofibromin is either not present at all or is malfunctioning and does not inactivate RAS. When this occurs, the active RAS remains active and does not have a regulator able to control the cell growth from the RAS, causing overgrowth of the cells and small tumors to form in the nervous system tissues.
The current direction of research for neurofibromatosis is gene therapy research that will hopefully one day allow scientists to find a treatment for neurofibromatosis rather than just treating the symptoms as they come.